So good day. For today's procedure, I'm going to assess the body temperature. Assessing the body temperature is a nursing procedure that provides the baseline data for the subsequent evaluation to determine the changes in the care temperature of the patient and then respond to a specific medical intervention. So the normal body temperature range from 26.5 to 37 degrees Celsius. So the purpose of it is to establish a baseline data for subsequent evaluation to identify whether the heart temperature is within the normal range and to monitor the patient's at risk for the imbalanced body temperature. So the first procedure that we're going to do is to review the medical record for baseline data factors that influence vital signs, identify the client and explain the procedure, and provide for privacy. So this is to ensure doing procedure to the right client and lessen the apprehension on the procedure. So this is to maintain the client privacy and promote the comfort. So good morning, sir. I'm Hayan Betara. I'm your attending nurse for today. So, sir, I am going to assess your body temperature so that we can know if there is abnormalities in your temperature. Is it okay, sir? Okay. So, the next one is we have to gather the necessary equipment, which is the electronic thermometer or digital thermometer with the disposable protective sheathing, with the 2 pairs of non-sterile gloves and alcohol wipes or cotton balls with alcohol and tissues, and bring to the bedside. So this is to promote the efficiency of the healthcare provider. So the next one is you have to perform the hand hygiene and or wash the hands and apply gloves when appropriate. So this is to prevent the spread of the microorganisms. So the next procedure that we're going to do is we have to assist the client to a comfortable position, either sitting or lying down. So this is to provide the easy access. So sir, using digital thermometer orally. So ask the client if he or she has taken hot or cold liquids or he is smoked. Then if yes, wait for 20 to 30 minutes after smoking or eating or drinking hot, cold liquid before taking an oral reading. So this is to make sure that the temperature reading is accurate. Okay, sir. So have you taken any hot or cold liquids?
No.
Okay. So carefully place it as far back under the tongue as possible. So place the tip of the thermometer under the client's tongue and along the gum line to the posterior sublingual pocket lateral to the center of the lower jaw. So this is to the superficial blood vessels, which are sensitive to heat, are present under the tongue. So instruct the client to close the lips around the thermometer and to keep mouth closed around the thermometer until it beeps and gives a reading. It may take few minutes, so tell the client to breathe through the nose while waiting. So this is to provide the sufficient or adequate time for recording the temperature. and breathe in your nose. So the next one is we have to remove the client's arm and shoulder from one sleeves of gown or clothes, avoid exposing the chest. So this is to expose the axilla for correct thermometer placement. So, sir. Okay, so make sure the axillary skin is dry. If necessary, pat dry. So this is to remove the moisture and prevent a false low reading. So after putting a probe, cover the tip of the digital thermometer. Place probe into the center of axilla by pointing upward towards the head. So fold the clients upward straight down and place the arm across the client's chest so the body heat is trapped. So this is to maintain the proper position of the thermometer bulb against the blood vessels in axilla. Stop laughing. Okay. So wait for at least few minutes until the thermometer beeps with the reading. So this is to provide the sufficient time for the recording of the temperature. So for better accuracy, take readings from both armpits and then average the two temperatures together. So this is to ensure the accurate readings. Sir? So using digital thermometer rectally. So provide the privacy and place the patient in a sideline position. And this is to maintain the client privacy and promote comfort. The sideline express anal area for the correct thermometer placement. So provide the privacy and place the patient in a sideline position. So this is to maintain the client's privacy and promote the comfort. So expose the anal area for the correct thermometer placement. So, sir. And then, don on gloves. So this is to maintain the standard precaution when exposed to the item solid, well, with the body fluids. So before inserting a digital thermometer into the anus, make sure to lubricate it with some water-soluble jelly first, so that the lubrication is typically placed over the probe cover to allow for easier insertion and increased comfort. So to reduce the friction and facilitate insertion without irritating the mucous membrane. So spread the buttocks and insert the tip of the thermometer no more than 1/2 an inch into the rectum and never force. If resistance is encountered, hold the thermometer in a place for 2 to 3 minutes. So this is to fully expose the anus for the thermometer insertion. So wait a minute or more for the thermometer to beep, then slowly remove it. So this is to provide a sufficient time for the recording of the temperature.
It's going to tickle. What? It tickles. Can I put my pants down?
Wait. Okay, you can put your pants.
I think I farted on the temperature.
So using a tympanic thermometer, before sticking the tympanic thermometer into ear canal, make sure it's free of wax and dry. So hair wax may interfere with the tympanic thermometer reading. So after turning the ear tympanic thermometer on and placing a sterile cover to the tip, hold the head still and pull back on the top part of the ear to straighten out the canal and make it easier for insertion. So to make it easy for the probe to be inserted toward like eardrum. So insert the tympanic thermometer into ear canal for 1 second while an infrared sensor record the body heat radiated by the eardrum. So tympanic membrane relies on the radiation of body heat. One infrared sensor. So we have to ensure that the probe of the thermometer is properly inserted into the ear to allow the optimal reading, and there is no need to touch the eardrum with the tip because the thermometer is designed to take a remote reading. So the proper positioning of the probe provides an accurate reading. So after creating a seal around the thermometer by pressing it against the canal, wait for it to take a reading and beep, then the reading then appears on the unit screen. So this to assess the result of the reading. For ear thermometer, a new ear probe jacket should be used for a different person. The ear canal must be pulled straight while measuring. So this is to avoid the spread of the contamination and infection. So the next inform client of temperature reading. So sir, your temperature in your ear is the 35.7. So for the patient to so sir, your temperature in your ear is 35.7.
So?
Okay, so it's normal. So for the patient to be aware for the result, so it is for the patient to be aware for the result. So next is we have to remove the gloves and perform the hand hygiene. So this is to prevent the spread of the microorganisms. Record reading according to the institution policies. So this is to obtain the additional data according to the rules.